guys, today we're going to be talking about electronic health records. So before we start, I'm going to first tell you a little bit about what they are. Electronic health record is defined as a longitudinal electronic record of patient health information generated by one or more encounters in any care delivery setting. Included in this information are patient demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports. Electronic health record systems have the potential to transform the healthcare system from a mostly paper-based industry to one that utilizes clinical and other pieces of information to assist providers in delivering higher quality of care to their patients.
So I'm going to be talking about the pros of electronic health records. So EHR have the potential to transform the healthcare system from a mostly paper-based industry to one that utilizes clinical and other pieces of information to assist providers in delivering higher quality of care to their patients, like you just heard. It allows providers to enter orders, which is very good for nurses. A lot of times you can't understand what the provider is saying, so it's really good to have it electronic based. It prevents less error in medications. Clinical outcomes include improvements in the quality of care, a reduction in medical errors, and other improvements in a patient-level measure that describes the appropriateness of care. Studies focusing on the patient safety have frequently examined the effects of EHR components on medical or medication records and errors. Using an electronic record, there was a 55% reduction in serious medication errors in the hospital setting. Organizational outcomes, on the other hand, have included such items as financial and operational performances, as well as satisfaction among patients and clinicians who use EHRs. Increased revenue comes from multiple sources, including improved charge capture decrease in billing errors, improved cash flow, and enhanced revenues. So that's just saying that we can actually charge electronically for things. So if you're getting a patient something like water, like a water bottle, or supplies, you can actually charge them. And then lastly, social outcomes include being better able to conduct research and achieving improved population health. Another less tangible benefit associated with EHR is an improved ability to conduct research. Having patient data stored electronically increases the availability of data, which may lead to more quantitative analysis to identify evidence-based practices more easily.
So, despite all of the benefits of EHR, there obviously are going to be some cons, and I'm going to discuss those today. So the biggest one is that anytime you are using a computer, you are risking unauthorized access and hackers. So a recent thing has been something called ransomware, where hackers have downloaded systems onto healthcare professionals' computers, and that has given them access to the information. This is obviously not a good thing, and then these hackers will hold this information and ask for money in exchange for it. So the goal is to obviously make sure this doesn't happen. So a lot of times practitioners will work with IT teams and put fireware on their computers, and this is super important. This can obviously cost the practice a lot of money, depending on what firewall they're using and what EHR they're using in the first place. So this is definitely a big con that should be considered when the practice is deciding on which system to use. And another con is just that a lot of times the EHR companies aren't updating their software. So depending on what software you chose, it might not be up to date as you continue on into the future. So these are all things that should be taken under consideration.
So as you've heard in this paper, we discussed everything about the advantages and disadvantages associated with the adoption of the electronic health record. So many of the benefits accrue to the patients and the society overall. So providers are expected to face technological and logical obstacles on their quest to achieve meaningful electronic health records. Nationwide, implementing them is necessary, although it's not sufficient. It's part of transforming the U.S. health care system for the better. So the EHR adoption must be considered as one of the many approaches that diversify our focus on quality improvement and the cost reduction overall. Thanks so much for listening to our video about electronic health records.